Today I'm super excited to be joined by Associate Professor Caroline Gurvich. She's the Deputy Director at Her Centre Australia and Head of the Cognition and Hormone Group at Monash University. It's very clear that Caroline has many areas of expertise, including hormones, the brain, thinking, menopause, and everything in between. In this episode, we take a deep dive into ADHD and why is it so often masked in women, but often unmasked by the perimenopause and menopause. Why are boys much more likely to be diagnosed than girls? I think you're going to love this chat as much as I did. Let's get into it. Caroline, thank you so much for coming on the podcast today. I know my audience is going to be so interested in what you've got to say, and this is definitely a topic that as a GP I'm having more and more questions about. So we're going to talk today about ADHD and particularly ADHD in women. Maybe we can start with just saying, what is ADHD?
Yes, good starting point, and thank you very much for having me, Shauna. So ADHD, Attention Deficit Hyperactivity Disorder, is a diagnosis. It's a neurodevelopmental diagnosis that is associated with attention or inattention or attention deficit and or hyperactivity and impulsive behaviors. So you don't have to have both, but you can have both. So the name ADHD suggests that you might have both, but some people, particularly women, just present with the inattentive aspects of ADHD. And ADHD, another way of conceptualizing it, so the disorder aspect is aligned with the DSM and our diagnostic criteria and the medical model of ADHD. But you can also, and it is often considered as a way or a neurotype, a way of thinking. So within that neurodiversity affirming framework, that suggests that there's lots of different brain types and lots of different ways of thinking. And the majority of our population are what we call neurotypical. So they have a more typical brain type and a more typical way of thinking. And then there are neurodivergent brain types and neurodivergent ways of thinking, and that's where ADHD would sit. And it's a different way of thinking about the world and a different way of the brain processing information and understanding the environment. So I guess they're different conceptualizations of ADHD, but both frameworks consider ADHD as something that's neurodevelopmental, that you're born with, and it's a different way of interpreting the world and thinking about things and processing information, and it comes with a range of different symptoms as well.
I have to say, as a GP and at medical school, I don't actually feel that we did have huge training on this, and it is because I've got 4 children. One of them's neurodivergent, and I've taken a bit of a deep dive into this topic, and it's so interesting, and it also made me realize that there are so many other sort of symptoms and signs in this, way more than just a bit of inattention. So what kind of signs or symptoms do people with ADHD have, or what do they notice?
So the inattention is like one word that describes a huge range of symptoms. So it can be, and it's different for everybody. So there's a diversity within ADHD as well. So people can have difficulty sustaining their attention on things, particularly things that don't really grasp people's interests, difficulty maintaining tasks. So often people with their inattentive ADHD type will start lots of things, get really inspired and excited by lots of things, but not really finish everything. So that could be, or anything, sorry, that could be like tasks, or it could be big things like starting lots of different university degrees and lots of different jobs, but nothing really sticks or eventuates. And that structure, that kind of what we call executive function, is really challenging for people to plan, to follow through, to stick to tasks. It can be hard for people to juggle lots of things in their working memory, so to hold lots of information and work with lots of information. And again, that's particularly the case when that information is not really interesting to the person. People can get distracted easily in conversation, either by things in their environment or by internal thoughts. So 1 minute you're engaged in a conversation and the next minute someone's interested in the background rather than what you're saying. And for someone who's neurotypical, having at the other end of that conversation, that can be quite challenging. And so it's difficulty like to sum it all up, it's really just a big difficulty sustaining attention and maintaining your progress on different tasks and activities.
I think when people think of stereotypical ADHD, they think of a little boy, who's jumping off the back of the sofa, or, climbing on a roof, or being naughty. And clearly, a woman in her 40s particularly doesn't fall in or seem to fit that stereotype. Why do you think it is that we've sort of skewed a lot more towards diagnosing boys with ADHD much more than girls?
I think originally it was probably because the diagnostic criteria, the DSM, was designed around that stereotypical hyperactive boy. So that's what the diagnostic criteria looked like. So when people were diagnosing ADHD, they were basing it off what the diagnostic set of rules were. And with the DSM-5, the new version, it's a little bit more catered towards adults in terms of some of the descriptors. But the stereotype still is that hyperactive boy. And a lot of girls are more likely to be inattentive. And so they fall under the radar often as girls, because sometimes they can be trying really hard to behave, maybe struggling still with that inattention, but they're trying really hard, and they might not be noticed so much in class because they're not disrupting anyone else. They might not be focusing. They might be looking out the window and daydreaming and starting their tasks and not finishing their tasks, but it's not disrupting the class, so it's not as noticeable and probably less likely to ring alarm bells for teachers and for parents in childhood. So that's that difference between that inattentive and that hyperactivity typically in boys. And so I think that's why a lot of girls are not necessarily diagnosed. But then as adults, the symptom presentation can change a little bit. And as you say, the women in their mid-40s are not going to be jumping up and down and necessarily on furniture and running around, but they might still have hyperactivity and impulsive behaviour, so not thinking through what their behaviours might look like or what the consequences of different actions might be. So there might still be impulsivity there. There might be a inner restlessness, a feeling that there's a motor going all the time, but it's not as visible to people as that really stereotypical hyperactive boy.
The media would have us believe that everyone's being diagnosed with ADHD and that, there's something of an epidemic of this diagnosis. I don't agree with that at all. But what I will say is I've been a doctor for 20-something years, and I've definitely had probably more women approach me in, I'd say, the last 2 years than I did in the previous 20 put together, thinking and wondering whether they may have an ADHD diagnosis. Are you experiencing a similar situation?
Absolutely. And I think the media has played a role in that, not necessarily a negative role, but I think there's more awareness now for women to present with these symptoms of inattention and to try and piece together something they might have been experiencing all their lives. So I think the media has helped kind of uncover some of those symptoms and provided people with the information so they can at least ask the questions of, could this be ADHD? Is this why I feel this way, or why I've had all these different experiences in my life? So I think that has helped, but I don't think the media has kind of created ADHD. It's always been there, but it's just given people an opportunity to learn and to have that knowledge, and then to ask the questions about whether they might have ADHD themselves.
Do we have a feeling at this point of what, the statistics are? Like how many people would seem to have a neurodivergent brain? Do we know that?
Yeah, I don't think the statistics have caught up with the recent uptick in people seeking diagnoses. So I don't think the most recent prevalence rates that I've seen are not very recent. So the good studies that look at epidemiological data, particularly in adults and particularly in females, there hasn't been anything recently to reflect what you and I are experiencing and most clinicians that you speak to are experiencing in terms of a lot more women coming forward in adulthood presenting with ADHD and questioning ADHD.
And although I definitely have a decent number of young women in their early 20s coming forward, I definitely have a larger group of women who would probably fall into that perimenopausal category, who are presenting with these symptoms. And, my feeling is that it is a collision of hormones, and that's often a time of life when women are juggling, children, jobs, older parents, etc., etc., etc. And maybe because they're not sleeping or they're having symptoms from perimenopause that the wheels are coming off. But do you think that is the reason, or why do you think symptoms seem to be coming to a head at that point?
It's a really interesting observation, and also I see that, and I think there's a couple of things going on. I think, so perimenopause in itself, putting ADHD to the side, is a time of life where, as you say, women are really stretched more often than not. So they're often juggling so many things, and when you're stretched, your cognition is not as sharp. So anyone who is super busy and has lots of things going on in their mind forgets things or has trouble following through on things just because there's so many competing demands. So that's one factor. And then you add into that the hormone fluctuations that are part of the perimenopause or menopause transition years. So we're losing some of the neuroprotective effects of estrogen, our sex hormone. And we know that estrogen acts in the brain, and it acts in brain areas that are really important and relevant for cognition and for mood. And so during perimenopause, the estrogen levels are fluctuating and gradually declining. And so that's another factor that can directly impact cognition because they're losing that estrogen. So I think there can be these brain fog type symptoms that women can experience during perimenopause that can look like ADHD. So people talk about difficulties finding the right words, difficulties concentrating, being forgetful, having difficulty planning and organizing. So that's perimenopause. And then there's the other thought for women who have not had a diagnosis yet of ADHD, that perhaps this stretched period of life or the loss of estrogen might uncover or unmask ADHD that's already been there, that's always been there, but you're losing some of that kind of scaffolding or some of that protective factors, either hormonal protective factors or just you're so stretched that it reveals something that you were able to hold together up until perimenopausal years. So that's another possibility for some people. But then for women who have had an ADHD diagnosis prior to entering perimenopause, from our research, there's not much research out there actually from other people, but it appears that women report a worsening of their ADHD symptoms as well during perimenopause. And again, it's probably related to that same combination of factors. So losing those neuroprotective effects of estrogen, which are closely also related to dopamine, which is a neurotransmitter that's very important in regulating our attention and our motivation and implicated in ADHD. So there's that hormonal role that might explain why ADHD symptoms might be becoming worse for some people during perimenopause, or it could be the additive effects of brain fog or of being stretched at that time of life and stress and mental overload or of mood changes. So I think there can be lots of factors that come together around those years that might explain either an uncovering of an ADHD that was already there or a worsening of that ADHD, or sometimes for some women it's not ADHD, it's more a brain fog, and it's better explained by perimenopause. So the cognitive symptoms might be better explained by perimenopause, not by ADHD.
Yeah, I've seen even in a few women where it actually has turned out to be a combination of terribly interrupted and very poor sleep, probably combined with increasing anxiety. So I think that definitely can sort of present with a bit of a mixed picture as well. My experience with some of the women that I've gone on this journey with in the last year or two, I'm thinking of one patient in particular. She was compulsively buying a lot of stuff online shopping and spending money that she didn't have. And she would be so full of regret, even before the parcel would arrive in the post, she knew that she needed to send it back because she knew she'd spent money that she didn't have to spend. She definitely was weighed down with a lot of shame because she could do the washing. She could put it in the washing machine, but she couldn't actually fold it or put it away. So she just have these washing baskets. And she told me at one point she had 26 washing baskets in her house. She would just go and buy more washing baskets and buy more clothes for, she had a big family. And I feel like a lot of women who don't have their diagnosis, they definitely feel inside that they're not quite measuring up to what's expected of them, and they're feeling this awful sense of shame of not being good enough because why can they not get the tasks finished? And she also described an interesting day where she went in to tidy her children's bedroom, but then got so distracted by the wall that she ended up driving to the shops, buying wallpaper, coming back, wallpapering the wall in their bedroom. But she'd never actually got the task that she was supposed to do done. And I think that those are very, stories that I hear. Do you have stories like that or does that resonate with some of the stories that you hear from patients?
Yes, all of those things do, particularly the not following through, then getting distracted by something else. People are often very busy doing lots of things, but not the task they initially set out to do. But yeah, those stories are exactly the sort of stories that I hear. People talk about similar sorts of things like in their university years sometimes as well, that they start assignments, they start a new course on top of a course that they were already doing, but they hadn't finished the first course, and then they have to end up dropping out of the first course. Or it can happen in the workplace where people start jobs that they hadn't really kind of thought through or planned through, and then again start taking up more and more responsibilities within the workplace because they get excited by things or distracted by things. So yeah, those stories they describe the symptoms, I think, really well.
Yeah, absolutely. And the other one I think, which really struck me with my own son, is this sort of absolute intolerance of boredom. So an inability to cope with boring things, even if it's sort of socially expected or expected for school, just this real struggle to do things that are boring. Is that a common symptom?
Yes, that is a really common symptom, that people can't do things that neurotypical people might not consider boring. For example, going to the movies. So some people talk about trying to go to the movies and just finding that so challenging to sit there because they just find it really boring. Or conversations that you think that should be something that would be interesting, but unless that the content really grabs people and is really interesting, a lot of people will say that they really struggle to listen and they start to get distracted by looking at the person's face or analyzing something else, and they're not listening to the actual content of the conversation because it's too boring, it's not grabbing their interest. Another one that's really common is sitting down for family meals. Some people find that really, really hard to sit at a family meal and to stay there once they've finished eating, the job's done. And the idea of sitting there and just sitting is really hard, and that kind of inner motor is just firing, and people have just got to get up and run away because they can't sit still. It's just too hard.
As we talked about at the beginning, obviously we're not going to have 40-year-old women jumping off the back of their sofa for activity, but what kind of things do you see women doing in terms of that motor activity or trying to suppress that motor activity?
Yeah, so that kind of motor that women talk about that's just on, sometimes it's small things like just a constant need to like fidget, hold things. And there's lots of really great fidget toys that are around now that make it really easy and accessible to have things to fiddle with. So sometimes that's like an easy fix for people, just to fiddle with something, even holding a pen and fiddling with a pen. So that's a small thing that some people just need something motor to do all the time. Bigger, more impulsive kinds of things, so not so much motor. They can be like impulsive kind of spending, that's people, again, not thinking through the actions, just doing things in the spur of the moment without really considering what the consequences might be. Some people, it might be hyperactivity in terms of just not being able to sit still, as we spoke about. So not jumping off the sofa, but sort of sitting down to watch a TV show with their partner, for example, and they sit for 3 minutes and then they've got to get up and go and do the dishes, and then they've got to sit, then they try again and sit down, and they've got to get up and do something else around the house. So it's just challenging to sit still and to focus on something. But often just being able to fidget with something is enough to allow people to be moving a little bit, but to also be present in the whatever the task is that the other task is that they're trying to do.
So I know that you guys work at the Her Centre and you're very involved in research. Where is this all going? Like, what are you guys exploring at the minute? And how are we going to look back in 5 or 10 years and do this all differently?
Yes, great question. So we're, in terms of ADHD, we're doing a lot of research to try and understand what that intersection is between hormones and hormonal changes and ADHD symptoms, ADHD medication efficacy. There's just so little research out there to understand how women experience ADHD symptoms and how that interacts with hormones. So we know a little bit about, puberty being a trigger for a lot of mood changes in terms of hormones and in terms of the psychosocial changes that happen during puberty. And in terms of ADHD, also understanding the extra mood changes that some adolescent girls might be experiencing, particularly if they haven't had a diagnosis of ADHD. And so then there can be misdiagnoses. So I guess one goal is to try and better understand presentation so there can be more accurate diagnoses for adolescent girls and for women. And so then sort of moving through the lifespan, like there's a lot of women with ADHD who talk about pregnancy and the perinatal period being another significant time of hormonal change, psychosocial change, and people find that really challenging. So learning to better understand what that looks like for women so we can support women. Sometimes just having knowledge of what people might expect. Of course, it's going to be different for everyone, but just having a little bit of knowledge about some expected kind of mood changes or challenges that people might experience. And then the other big hormonal shift that women experience is around menopause. So there's so much more work to be done, particularly around menopause, in terms of understanding symptoms that neurotypical and neurodivergent women experience in terms of their psychological symptoms, so mood changes and cognitive changes. And they're really commonly reported, but when people think of menopause, they think of just the hot flushes and the night sweats, and they don't really think about and don't expect some of the cognitive changes or the mood changes. So for women, these can start in their 40s when their hormone changes might start to kick in, so in those perimenopausal years. And so for women, neurotypical women or neurodivergent women who might also experience a worsening of their ADHD symptoms, from our research, we're hoping to better understand this, better learn about different hormone therapies and how they might be helpful for everyone, neurodiverse approach, both people with and without ADHD. So we still don't know a huge amount about how hormones can help mood and cognition. And at the moment, hormone therapy is not indicated for either of those psychological or brain symptoms, but you can take it for other symptoms. So anecdotally, a lot of women do report benefits of hormone therapy for a whole range of symptoms. So just building the evidence base around how hormones, our sort of endogenous hormones, the hormones inside us, when they fluctuate, how that impacts our mental health and our cognitive health, and then learning about when we add in hormones, how that also impacts all of our different psychological sort of well-being and symptoms in both neurotypical and neurodivergent people. So I guess coming back to your original question, our goal is just to learn more so we can help women who really have been largely neglected. If you go back many years, all medical research was around males and not really catering for females. And so the more we can now add in how hormones play a role in mental health, the more we can understand that and the more we can help women and target specifically women, not just trying to generalize something that was designed for males to females.
Caroline, I probably don't have enough patience to have got a feeling for this, but just out of interest, do patients that you have who've already got a diagnosis of ADHD ever report a fluctuation in their ADHD symptoms on a monthly basis along, with the menstrual cycle. Is there any connection to that apparent?
Yes. So we have just done some research, which we're just still analysing all of the data, but our preliminary data shows that women show an exacerbation, a worsening of symptoms in that premenstrual or luteal phase of their menstrual cycle. So that's when progesterone increases just before women menstruate. And we know that some women report mood changes around this time of their menstrual cycle. And for women with ADHD, we're also seeing a worsening of symptoms around this time. We did a survey last year in women who already have a diagnosis of ADHD, and I can't remember the exact statistics, but a large majority of women reported a worsening of their symptoms premenstrually. And so whether this is just symptoms worsening or whether this is stimulant medication being less effective, there's also one research study out there that looks at perhaps changing dosing of medication premenstrually. So, but there is definitely a pattern of a worsening of symptoms premenstrually or in that luteal phase in women with ADHD, as well as a lot of women reporting just mood symptoms generally in that phase of their menstrual cycle, as well as a lot of women who have no symptoms at all across the menstrual cycle. So, some women are not sensitive to hormone fluctuations, but a lot of women are.
Wow. I mean, it's just so interesting. I mean, I've obviously been lucky enough to have Jay Ashery on here before. And I think, a lot of people are surprised to know that estrogen and all these hormones that they associate with periods and having babies have such an impact on our brains. And I think, we're, even as doctors, we're only just coming to the party and really beginning to understand some stuff that's probably been, it's sort of nearly been plain and obvious in ways to us, that people have postnatal depression and the baby blues and what happens at that time, massive hormonal changes. And yet it's sort of been kind of obvious, but it's sort of been also missed for a long time. We haven't, I don't know how, we didn't quite put it all together. But anyway, it is so interesting to me. And I think even the fact that estrogen and progesterone and testosterone still keep being referred to as sex hormones, I think just keeps putting those hormones back in a box, that there's something only to do with babies and having babies. And in fact, but they're really messengers in all parts of our body that without is such a struggle really for a lot of women. So anyway, sorry, that's just a bit of a thought of mine. I'd love to know, I know that you work on lots of cognitive training. Can you tell me a little bit about that and what it involves?
So there's different types of cognitive training, which is really broadly an idea of trying to improve our cognitive skills or optimize our cognitive functioning. The type of cognitive training that I do is what we call compensatory cognitive training. So it's not like a drill where you do a particular task over and over and over again until you get really good at that task. It's not that. It's about understanding our cognition and putting strategies in place to make the most of our thinking skills. So, for example, with memory, often we find that our working memory, our ability to hold information in our head is limited, and we struggle. We start to forget things because we can't hold too much in our working memory. So instead of trying really hard to hold more and more in your working memory, we think about what strategies can we put in place, like really practical strategies to kind of reduce our mental load. So writing things down or using routines. So we're reducing how much we have to carry in our mental load. We also look at different ways of optimizing our broader memory function, our ability to learn and take in information. And often, if we don't have like a primary memory problem, often it's because our attention is failing us, where we're not focusing on the piece of information we want to learn. So it's difficult to learn new information if you're not taking it in the first place. So we sort of break down the processes of memory and we think about what can we do to maximize our attention and maximize our focus and take in information. So then later when we need to recall it, we can. So we think about practical strategies to try and eliminate as many distractions in our environment as we can, to try and use self-talk to bring us back onto a task, and we practice those strategies of kind of active listening, active attention, and then we see if it helps people's memory. So we do practical tasks in our cognitive training program to help with that. And we also spend a lot of time thinking about our executive functions, which is our controlled by the front part of our brain. And it's our executive functions are often considered like the CEO of our brains. And these are really relevant for neurodivergent brains, which struggle even more with managing our executive functions. So these are the skills in our brain that help us follow through on goal-directed behaviors, that help us plan and organize. And our executive functions help us focus our attention on what's relevant or what we need to focus our attention on, and monitor our behavior and adapt our behavior to keep meeting or trying to meet our goals. So we also look at different strategies to help maximize our executive function and help put as many kind of compensatory supports in place to help us build routines. So if our executive function is not working, we want to externalize that. So make a routine, or have, some people call it like a body double, or have a diary, or have something that helps us be accountable and to help us stay on task or stay on track or follow through or plan or organize. So the cognitive training programs that we run, at the moment, they run over 8 weeks, and they're group-based, face-to-face, and we have an online one as well. And they go through all different cognitive processes. Because they're for women, we talk a lot about the role of hormones and how hormones might impact our mood and our cognition. We talk about how mood impacts our cognition. So we talk about the role of stress, that sense of overwhelm, and how different strategies, we brainstorm strategies to help manage that. And it's very much at an individual level. Everyone's got a different profile of cognitive strengths and cognitive weaknesses. So it's about kind of reflecting on that and thinking about strategies that you can put in place to compensate, to help, and to optimize and maximize your own cognitive function.
Caroline, can you give me some examples of some strategies that you might use to stop yourself getting so distracted?
So we talk about preparation first. So we think about what is distracting us. So that's always the first question that we ask people to reflect on, how they get distracted. And sometimes there's a few easy fixes. So sometimes people get distracted because they're not necessarily in tune with their internal body needs. So sometimes people just need to go to the bathroom or need a drink or need something to eat, and they're not able to focus because that's distracting them. So reflecting on your own internal needs is a starting place, just to have a drink or have something to eat and see if that helps your focus, or just be aware of that. Thinking about people's physical environment. So if you're somewhere that's really noisy, a lot of neurodivergent people also have lots of sensitivities to sensory information. So trying to either minimize your sensory stimulation, get the lighting right, take out background noise, put yourself somewhere quiet. Or for some people as well, that is not helpful. And some people need a little bit of background white noise or brown noise or music without lyrics to help focus. So trying to modify your environment to be able to maximize your focus. Then there's some other strategies once you get all the environmental and personal factors right, to keep on task. So using in a conversation, for example, it might be asking questions. So you're keeping engaged in the conversation and asking questions, paraphrasing. So if someone says something like, oh, Shauna, you just asked me to tell you about some attention strategies, so I'm going to tell you about some attention strategies. So just kind of paraphrasing and keeping active in the conversation can be another way. If you're not in a conversation and you're on your own, you might be reading. You can apply the same technique. So you read a little bit, you might highlight things to keep on task, and then you might explain things back to yourself in your own words. Some people use self-talk. So if you're someone who often walks into a room and thinks, why am I in the kitchen? I can't remember why I walked in here. So using self-talk as you're going into that room to help keep you on task and keep your attention where you want your attention to be. And then there's broader, more executive function type strategies of really making sure that the task is something you can attend to. So keeping tasks short, breaking down tasks to try and reduce that overwhelm. So you're able to attend, if you know in yourself that you can only focus for 10 minutes at a time, then set yourself a timer or set yourself a little goal to focus for 10 minutes and then give yourself some sort of reward or a break after those 10 minutes. So you know that the task might be time bound. Some people really need to know when the task is going to end, because like just sitting down to do their taxes or sitting down to write an essay is just too overwhelming and they cannot focus because it's just this endless, huge task. So making it a really small first step, achievable step of the task can be a really good strategy to help bring your focus in. And it might even be that you can only get the task ready the first time you want to do it. So you just might set up a table with the task physically there ready to go, and that might be the first thing. And then the next time you come back, you might say, okay, I'm going to just focus on this task for 5 minutes. And you might just do that and then reward yourself. And so it's just a combination of being in tune with yourself and your environment and knowing what you can do, not pushing yourself too much, and then just using different strategies around you to help keep your attention on task for however long you can do that.
One of the strategies I have been trying to use with both my son and recommending to patients is whenever you're struggling to get started, just tell yourself that you just have to do it for 5 minutes. So give yourself that you're going to have an exit clause within 5 minutes. You got to just do 5 minutes of your homework. And then obviously people usually continue and do it for longer than 5 minutes. But I do think it's sometimes the getting started is really challenging as well.
Yes. Yeah. A lot of women talk about that just being that sense of overwhelm, and it just builds, and then they build the task into this huge thing, even though they know they've done that task before or they're able to do it, but it just becomes so overwhelming that the thought of it is just scary and anxiety provoking. And so it's just working with women to bring it back to something that's achievable, and it might just be the smallest first step, but often that's enough to get started. But then in terms of ADHD, it's often that people do get started and distracted and then get started on a new activity and then get distracted and started on another activity. So it's also about sort of limiting yourself to trying to do one thing at a time. And yeah, even if it's only 5 minutes on each of those things, but just giving them a sense of time to try and sit down and do whatever that task is.
One of my patients asked me a question the other day, and I think it's one that a lot of people struggle to understand. Why do we give people who are already sort of in ways have a racing mind, why do we give them a stimulant? It sort of seems like it doesn't really make sense. Can you explain that?
Yeah, that's a common question that I get as well. And I think it's just about regulating the neurochemicals that underpin our ability to regulate our attention. So regulating dopamine, it's not that you're stimulating your brain really, it's just that you're regulating. So I think of it, ADHD as difficulties regulating attention. It's not that people can't attend, it's that they can't regulate how long they attend to things for. So the stimulant helps with that regulation of attention and ability to regulate that neurotransmitter system that underpins attention regulation processes.
A patient brought in an article to me recently, and it was all about how people with ADHD are overrepresented in entrepreneurship, and they tend to be very entrepreneurial. And this patient was kind of really wanting, on the one hand, to pursue a diagnosis of ADHD because she did feel that there were bits of her life that just felt chaotic and she couldn't follow things through. But she was really worried if she went on medication that somehow she was going to lose this sort of amazing part of her brain that was always coming up with ideas. Is that something that patients worry about when they chat to you about starting medication?
Yes, but I should say as well, I don't prescribe, because I'm a neuropsychologist, I don't prescribe medication. So I often defer those really detailed discussions to GPs and psychiatrists. But we do talk about the impacts of medication on people. And a lot of people do have concerns, and people can always try things as well. And so you can always try things, check in with yourself and see how you're going and be aware and monitor your behavior, your response. And some people find that medications really just help them to be able to focus when they need it. So it might not be something that they take all the time. It might just be when they need to really be able to maintain their focus for periods of time. So I always think it's important just to keep checking in with yourself and keep the discussions going with your GP or psychiatrist. So it's not that you suddenly start taking a stimulant medication and then that's it, you're committed to that for the rest of your life. It's just about, trying things and seeing if it helps some of the symptoms that are causing impairment, because I guess that's another feature of the diagnostic criteria, that you have to have symptoms that do cause an impairment in more than one aspect of your life. So you do want to manage that and to optimize your functioning. And so if medication is something that's going to help maximize your functioning, but without taking away your creativity or that spark that you have inside you, but it's important to check in, because it's very individual what responses will be to different medications. So just keeping an eye on it and keep reflecting is I think a really important process.
What do you think the impact is for women of having these diagnoses at quite a late stage? Like, obviously you're spending in-depth time talking to women. Do you feel that, deep down it impacts people's self-esteem and self-confidence and sort of trust in self, because they've probably for a long time just felt they weren't quite measuring up, or they weren't quite managing to do things the way everyone else did? And I suppose I'm interested to know, is that something that you have to invest quite a lot of energy within therapy to work through?
There can be lots of different, I think, responses to women who receive diagnoses later in life. Sometimes there is a grieving loss kind of process, because people reflect on all the lost opportunities that might have been there had they understood themselves better earlier in life. And so, that can be really sad for people who have struggled for very many years, not feeling quite right. And there can have already been huge impacts on self-esteem, and people not being able to do things and blaming themselves, thinking there's something wrong all the time, and then suddenly discovering, actually my brain works differently, my brain thinks differently. Had I known this however many years ago, that would have changed the supports I put in place, or that would have, had I received medication or intervention or treatment earlier, that would have helped me or helped me manage. And so there sometimes can be that sense of grief or loss for people, for the lost opportunities that they might have had, or for the struggles they went through without that sense of understanding. Then there can also be a aha moment, like, oh, this makes sense, that all my life I've struggled with different things and now I understand why, like the why factor's there. So there can be quite different responses to receiving diagnoses later in life, and understanding that framework is a really big part of the diagnostic process, not just, here's a label. It's about understanding, what does that mean, and how can you now use that framework to optimize your cognitive functioning, or optimize your behaviors, and understand yourself, and then potentially also working through the feelings of self-reflection on past opportunities, lost opportunities, past struggles. So yeah, it's kind of the history side, and then the moving forward side as well.
Do people with ADHD struggle more with anxiety and depression, or is that something that hasn't really been answered?
So yes, they do struggle more with depression, anxiety, and particularly women. I mean, females generally struggle more with mood disorders, depression and anxiety, compared to males. And particularly people who have had undiagnosed ADHD, there can be coexisting depression and anxiety, but particularly when it hasn't been diagnosed, and so things have been misinterpreted, and there can be side effects of that, just a reactive depression. So not even a depression because of brain changes, but just a reactive depression to struggles that people have had, and not knowing why they can't do things or why they're failing at things, without having that understanding, so that people can become quite depressed and anxious about doing things because they've struggled in the past. But there's also a higher rate of depression, anxiety in women as well as in women with ADHD.
Okay. And can you tell me a little bit about hyperfocus that some patients describe? What does that mean?
Yeah. So women describe that, and males with hyperfocus, but that symptom is just getting totally absorbed in a task that they're really interested in, and just time disappears, everything disappears. And some people have talked about 7 hours might pass and they've just been, for example, researching a topic or engaged in like an art craft kind of activity that they really enjoy. And all this time passes and all the responsibilities that were supposed to happen in that time just pass. And there's just this extreme ability to really focus on something, which seems counterintuitive when we talk about the diagnosis of attention deficit. But for a lot of people, it comes with this hyper capacity to really focus on something for long periods of time, which can be a huge advantage in lots of different professions or lots of different aspects of life. But it's kind of knowing how to use that to your advantage and to maximize that, so you can kind of get lost in the right activities and lost in activities, and that's okay. That can be a great attribute, but it's just kind of knowing how to use that.
I see sometimes patients come to me, they want a referral to go to see a psychiatrist, get a diagnosis and start on medication. And obviously I'm always keen for them to go and have some therapy as well. I'd love you to perhaps speak to that and what you think therapy adds to, alongside medication, and why perhaps people should consider doing both.
Yeah, so just from an evidence-based perspective, both medication and therapy combined is the most helpful approach. And medication's not for everyone, and there can be side effects. And so I think exploring and understanding yourself and your brain and how your brain works with the environment is so important. It can be so helpful. And so therapy can help with that, can help with putting structures in place to support you and to optimize functioning. I think understanding, though, is really one of the key features of therapy, is just understanding yourself and how your ADHD brain might work in comparison to how you previously thought and were trying to train yourself to be. So I think therapy can be really helpful for that. There's lots of ADHD coaching programs that are around now as well that can help kind of harness strengths and build strengths and maximize all the strength aspects or good aspects of ADHD, and then compensate or work with the challenges that people might also experience, and put supports in place to help get through those. So I think it's really important to have a broad understanding of your symptoms and what they mean, and your ADHD. Like, not everyone considers them even symptoms. Like, it might just be your way of thinking, but understanding that so you can make the most of whatever opportunities you have in your life is really important.
Caroline, if someone was thinking that either themselves or someone they know may have ADHD, is there a questionnaire or anything that you think is a good starting point that someone could complete at home, for example, to see whether they fulfill any of the criteria?
There are lots of questionnaires out there on the internet, and anyone can find them. And I think it's I guess there's two ways of looking at it. Some people feel that if you do lots of research and a diagnosis of ADHD resonates with you, then that's kind of enough to have that self-diagnosis, and you can feel comfortable with that and you can work with that. But I think it's also really helpful to talk to someone professional and seek a healthcare professional's opinion, because there can be lots of things that look as well like ADHD, and sometimes people can struggle with their attention for a whole range of different reasons. And sometimes you can tick yes on questionnaires. It's quite easy to tick yes to lots of different options on questionnaires that we all may, if you think about the actual items on those ADHD questionnaires, they're things like, making careless mistakes, or forgetting your keys at different times, being forgetful, or losing your attention if something's not particularly interesting. So most people would be ticking yes to a lot of those things, but they don't necessarily cause functional impairment for people. And so I think if you read a lot about ADHD and it really resonates with you, so if you're someone who really feels like you start lots of things and don't finish them, or if you really struggle to maintain your interest in things all the time, it's pervasive. It's not just when you're feeling really bad in yourself that your attention fails you. If it's pervasive and it really is having a big impact on your life, I think it can be really helpful to read about it. Yes, if you want to complete the questionnaires on the internet, but to go and talk to GP and work out next steps, I think it can be really helpful if it's causing something that's causing you impairment in your life.
Caroline, as someone who's obviously working right in the guts of this field, is there any messages or anything that you would love people to understand a little bit more about this subject?
Yeah, so I think there's lots of changing views, I think, about ADHD, and there has been more recently with all the media attention, there's also been a lot of stigma about it and people considering ADHD like a really fashionable label. And I think for people to know that it's, from most people's perspective, that is a neurodivergent way of thinking, it's a different way of the brain working, is a really good framework, I think, to understand ADHD. And for people who feel like they might have ADHD, to as I said before, to go and seek professional help so that you can optimize your functioning and make the most of things and, thrive as an individual by learning about how your brain works. I think that can be probably my take-home message, is just to consider it a different brain type that can be that can come with challenges for a lot of people, but seeking the right supports and professional help can really help people make the most of things.
Caroline, do you have any books or resources that you direct your patients to that you think are particularly helpful?
Yes, there are a lot of good websites and good resources that I have, and I have got names of books written down, and I don't have them in front of me now, but I don't know if you have a website if I can give them to you to put on your website. The show notes, yes, that's the word I'm looking for. If I could give them to you, yes, there are lots of good resources, because on the flip side, there's also a lot of rubbish on the internet as well that's not necessarily helpful and can send people on the wrong track. And so it is important to have good quality resources. So yes, I will give those to you.
Absolutely. I would love those, because I think, people can get really overwhelmed. I mean, there's even little questionnaires that pop up on Instagram and things. So it would be great to just be able to send people to really good information. I just had one last question for you, and I don't know whether you guys are researching this or not, but do we have any clear understanding about brain fog and hormone changes and what is actually going on in people's brains whenever we've got this brain fog in the perimenopause and postmenopause?
Yes, that is something that we are researching, because there's not a huge amount of information about what that is. In terms of what we know that these hormones that change during perimenopause and early postmenopausal years, we know that these hormones are really active in brain areas that are really important for cognition. So the brain fog, as we talked about a bit before, can really come from hormone changes. So it's a real thing. It's experienced by probably 2/3 of women during the perimenopausal transition years, and it can be really subtle. So it might be that some people can't find the right word, that tip of the tongue phenomena every now and then, and it's not really bothersome. Or it can be really significant. And sadly, I've seen so many women who have actually left their work because they feel like they're no longer up to work because their brain fog is quite severe and they really struggle. So we know that it exists. We know that it exists in a range of severity. In terms of what it translates to in terms of cognitive processes and neuropsychological processes, we also know that women who are experiencing brain fog are still cognitively very able. So women are not losing their minds. It's not that. Women are not losing their cognitive capacity. So women are still able to perform really well, or as well as they probably were previously on a lot of neuropsychological tasks when they're assessed in a really structured clinical setting. But in day-to-day life, women often feel like they're just not able to keep up with the demands and need supports in place. So when I say supports, it might be that women, had they made the connection between brain fog and menopause, the same women might not have left the workplace if they could have understood what was going on and could have had some practical strategies so they weren't, for example, in the workplace, if people are kind of shouting out things in the corridor like, hey, can you do this? They can know that if they write it down, they'll be able to do it, but they might not be able to hold all those bits of information in their working memory, so they might forget. So they just need to write things down. So just having women understand that brain fog can be a really common symptom of menopause, but their cognitive ability is still intact in terms of being able to perform tasks, but they just might need some supports to kind of get through and be able to maximize their cognitive functioning. So in terms of why women experience brain fog, we talked about hormones, but then all the other menopause symptoms that women can experience are all kind of additive factors, or even on their own might lead to degrees of brain fog. So you mentioned sleep earlier. So yeah, lack of sleep in anybody can impair cognition and lead to a foggy kind of brain. So that can be one factor that makes brain fog worse or can drive brain fog on its own. Mood changes, anxiety, those mood changes can also have cognitive symptoms on their own, but then you add in hormones or you add in lack of sleep and it can make brain fog a whole lot worse. So women can experience brain fog on its own, just as the only symptom of menopause, but more often it's a combination of symptoms that women can experience during menopause as well as the brain fog. So there can be lots of additive factors and just life at a phase of life being really stretched and really busy and carrying lots of things in your mental load means that other things drop off. You forget things and can be a bit more forgetful, not because you're losing your memory, but forgetful because your mental load is full.
The reality is, though, and I'm sure you've had the same, I've had a number of patients extremely worried that they've got dementia. So, for anyone listening out there, that is how severe some people will feel the symptoms, but you don't have dementia. It's highly unlikely that you've got dementia. It's much more likely that this is a very common memory issue that we see at this time, but people can become quite frightened by it.
Yes, definitely. And the dementia question is a clinical question that I often get asked, that people present and say, I think I've got dementia. They're often quite convinced. Some people, patients have rung Alzheimer's Australia and said, they've said, I'm ringing because I've got dementia. But they don't. They've got brain fog during menopause, but it is, for some women, as I said, it can be a range of symptoms. So for some women, it can be really debilitating and really scary. And sometimes that anxiety makes the memory problems even worse. But I guess really rough rules of thumb is that most people who are perimenopausal are just under the average age of onset for Alzheimer's. They're not likely to have Alzheimer's disease purely because of their age. It makes it less likely. And 2, people with Alzheimer's disease do have a primary memory disorder. They do have an inability to learn new information, even if they're really focusing and really trying hard to learn that information. Whereas someone with brain fog during menopause, if they are able to really focus, they can take in new information and they can recall that information later. They might find in day-to-day life they're often forgetting things, but it's probably because they were distracted or not focused on whatever information they were trying to take in. So a really quick check for women is just to be able to try, reading something or having a conversation where you are really focused on that and just testing in, can you recall that 10 minutes later? And that's just kind of a good check-in to know that your primary memory is okay, but in day-to-day life, there might be lots of factors that are making it hard for you to take on lots of new information and recall lots of pieces of information. But it can be really concerning. And again, if people are really concerned, it's always great to reach out and seek professional input and speak to your GP and get some advice, because that can be reassuring, and trying to minimize that anxiety can be really helpful in treating the or partially treating some of the brain fog symptoms as well.
Yeah, thank you. Thank you for sharing that little test and tip, because that's actually a really good one, just to confirm to yourself that you can learn a piece of new information. It can be obviously really reassuring. Caroline, thank you so much. You've been really generous. I've only got one last question for you. You'd be glad to know. I would love to know if you could give your 20-something self a piece of advice, what you would tell 20-year-old Caroline.
So I would say to not be so kind of hung up and stressed and concerned, and take a few more risks. So I'm not a risk taker. I'm kind of risk averse and quite conservative in the way I do things. And I just think if I could look back and change things, I would have pushed myself a little bit more to try new things and not be so scared of failing, or not be so scared of making mistakes, and just, do more stuff. So I think that's what I would like to tell my 20-year-old self. Just give things a go and not be so worried about what the outcomes are.
I think I resonate with that a lot. I'm very similar. Caroline, thank you so much. You've been absolutely amazing.
Thank you so much, Shauna. Thanks.
I think you'll agree we've had some incredible guests on the podcast already, and today's was no exception. I think there is so many nuggets of information I'd love to get out there. So if you know someone who would benefit from the podcast, please share it. That way more people can learn all about themselves. Remember, this podcast is all about you. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.